Good evening, everyone present. Panchajanya, the divine conch of Bhagavan Sri Krishna, which was blown during Kurukshetra, indicating the start of Dharma Yuddha that followed. There, all the efforts were done for the establishment of Dharma. Dharma was kept over personal relations and motives. Keeping the same motto in mind, our organization will work towards establishing the importance and necessity of imbibing Bharatiya culture, accepting our roots, and making people realize the true essence of Ayurveda, not only as a treatment modality but also as a way of life. All this while working in a path of Dharma. Hence the motto Shreyam Bharatiyam Arogyam Ayurvediyam. Our main goal is to reach every individual in creating awareness of our ancient knowledge and wisdom, its efficacy in the modern era, and link with current ongoing affairs. Its revival, and most importantly, bringing everyone together in working towards establishing a strong system. In order for all this to be achieved, we have set up various wings with working principles and objectives that help achieve the goal faster and easier in coming years. They are Ahilyabai Wing, Swami Vivekananda Wing, Karnata Bala Wing, Govardhana Wing, Ashwini Wing, Narada Wing, Kautilya Wing, Vedavyasa Wing, Nalanda Wing, and Sanjaya Wing. Coming back to the members involved in our organization, we have doctors, healthcare workers, teachers, students, and people from almost every single occupation available aiming at working together and bringing forward the true essence of Bharata and her traditions. So, all those who fit under these categories are welcomed with honor and privilege. Today, this evening, we have Dr. Shalini ma'am, who is currently working as an associate professor in Department of PG Studies in Swasthavritta in JSS Ayurveda Medical College and Hospital, Mysuru. Ma'am attended more than 40 national and international conferences and received Best Poster on the topic Conceptual Study on Yogic and Lifestyle Management of Hypertension in International Conference Wellness Meet 2016, Bangalore. Ma'am has published 10 more than 10 publications, recognized resource person, and ma'am has research projects undertaken more than five. We are really honored that you accepted our invitation and you are doing this session, ma'am. Thank you so much, ma'am. You can carry over the session.
Thank you for the introduction. Namaste. With pranamas to Dhanvantri, I take this opportunity to start this session on health statistics. I hope you can follow the session. To introduce myself, I am Dr. Shalini, Associate Professor, Department of PG Studies in Swasthavritta, working in JSS Ayurveda Medical College and Hospital, Mysuru. So, to begin with, we know what is health. It is a complete state of complete physical, mental, social, and welfare, and not merely an absence of disease or infirmity. So, we know what is health, health related status. We have to analyze, we have to determine or differentiate, and we have to correlate and to prevent and improvise the treatment modalities and management of certain diseases and other sectors of health. So, for which we need statistics, or for which we need data analysis, or for which we also need assessment of the status of health. How do you assess? We need so many methodological assessment. Based on that, we have a calculation. So, what is statistics? The term statistics is derived from Latin word statisticum, collegium, or council of state or status, which means political state, and Italian word statistica, which means statesman or politician. This is an earlier statement, but it says first statistician word was used in to collect the information, that is the data collection from the total population residing in Egypt, for estimating the number of persons capable of payment of tax. So, how many people paid tax, how many people did not, what is the difference, where the person has not paid, why he hasn't paid, how much is pending. To know that, earlier in Egypt, this statistics was started. Later, it has got many transformation in the name of Statistics, presently terminology is statistics. For us, health statistics is very important, but in plural form, the definition of statistics goes like this: systematic collection of numerical information. Anything that we collect the data in the form of number is called as statistics. So, like example, in this year, collection of data related to admission of BAMS students for the course of BAMS. How many students? That is an example. That is a collection of number. In singular sense, the statistics is the science of collecting, classifying, presenting, interpreting. That is, you try to collect from every sources wherever you get the information regarding that continent of subject. Then you classify based on male, female, sex, color, race, ratio, religion, anything. You classify in your own basis. Then presenting. After classification, you present it. So this is the data that we have analyzed. Later, you interpret. So this may be the answer. So you have 20 students, 40 out of 20, 10 people are boys and 10 are girls. That is how you interpret the data relating to your classification. That is data related to any sphere of inquiry. It is a scientific method to making inference and to draw conclusions from the numerical data. Biostatistics, it is the study of numerical data related to biological facts or events that can be analyzed and interpreted by the application of statistical techniques. So related to any biological facts, it might be any event related to biological facts. When it comes to medical statistics, it is a study of human health and disease, something pertaining to human health and its diseases is considered as medical statistics. It is a sub discipline of statistics and defined as it is a science of summarizing. So you summarize how many people are ill, how many are healthy, how many are having fever, how many are having acute gastroenteritis. So you summarize, collecting, presenting, and interpreting data in medical practices and using them to estimate the magnitude of associations and test hypothesis. Medical statistics deals with the application of statistics to medicine and health science, including epidemiology, public health, forensic, clinic, and clinical research activities. So it might be for any purpose. You might take, recently we had a very good statistics results related to COVID. How many people got COVID? How many are being treated? How many are being negative? How many are death? How many are reappearing again with COVID symptom after first generation of COVID, second time secondary attack? How many? So that is how you analyze the epidemiological data will be analyzed, then public health role will come, then the forensic, then the clinical research. So definition of health statistics goes like this: statistics employed in gamut of health science, including curative, preventive, promotive services, is called health statistics. So you got the data, how many people are not well of a certain disease. So how do you curate? How do you cure that disease? So you are having 100 patients of COVID, for example. So then you have to try to treat COVID people. So how many medicines is required? How many hospitals are required? How many people need hospitalization? How many people need just a clinical medicine? How many people need doctors? How many people need intensive care? That is and how many medicines are required? Do we have stock, arrangement for stocks? All that comes under curative. Coming to preventive, how do you prevent? Already 100 have got, it might be a next day, it might be 200 because of the spreading of the COVID cases if the people are not isolated or prevented. So what is a preventive care you take? That is distancing, hand sanitizing, isolation. All this comes under preventive measure. Promotive services, so if you do this, you can prevent the disease. What are the promotive services the government of India tries to adopt? So those things comes under health statistics. These are the uses of those. So where do you get this health statistics? Where is the data that you get out of each medical records and about health of human and the disease of health? That is from hospital record, census, registration of vital events, sample registration scheme, notification of diseases, hospital records, disease, disaster, epidemiological surveillance, and environmental health. Uses of health statistics. How do all these records you've already got? Then what is the use of this health statistics? So it is used for understanding the risk factors for community. So you can understand this disease is more in high magnitude. So what is the risk factor of this and what will happen to the community? To track and monitor disease, where the disease has traveled, where is that person who has traveled with this symptom, how can we track him, how can we make sure he's taking medicine like we do it in tuberculosis. Dots program is for that. To seek the impact of policy changes and assess the quality and safety of healthcare, to ensure health status of population, to compare the health status of one community to another community, to know the health needs population or community, to plan, implement, evaluate the health programs, to conduct research in health programs. So any health problem is there, you can go for conducting. So this was the done. You can take out the statistics and you can implement certain health programs related to that. Data collection. What are the types that where you collect data? How, if without data you cannot implement any preventive, promotive, or curative measures in health statistics. What exactly is called data? Data is nothing but collection of information related to any sphere of inquiry is called data. Data is of two types, quantitative and qualitative. Those two types you should know because you represent that data in different forms. So quantitative data, data which can be measured by using some devices. So how do you quantify, right? We say weight, height, blood pressure, HB, all these things comes under quantifiable data. So like blood pressure is can measured by sphygmomanometer. That is why you can assess the diastolic and systolic blood pressures. Likewise, HB, height, weight, all these can be quantitative data. But whereas qualitative data, data which cannot be measured by any devices. Devices cannot assess the data or cannot be analyzed. So these are pain, age, sex. These are the subjective parameters. Sources of data. Sources of data are experiments, records, as services. People who have done experiments, they would have kept as data format or records in hospital records and others, survey, all these are the sources of data. And the collection of data is a primary and secondary. So primary, you go to the direct source where the exact outburst or where the exact event has taken place. Like if you have to go for the birth rate analysis, you go to the municipal corporation or a respective hospital and count for how many birth has been occurred in this month or this day or this particular year. So you get the direct data from them, or it is from the secondary source. It is from your internet or those websites where you get the secondary data, where the primary person would have fed the information into the system. So primary data collected by the investigator himself or by his subordinates directly from the source of information is called primary collection of data. Like your attendance, for example. Your attendance in the class, they try to take the attendance, they take the count and your name is collected there itself. But whereas the secondary information is secondary data, this data, how many students are present or your class coordinator or your principal will be getting the data from the primary person, like the class teacher or the subject teacher who takes the attendance. That is a secondary data. This or the university takes the attendance for the exam purpose, how many percentage the student has attended or not. That comes the secondary data. So by direct observation, this is more accurate but not practicable in the extent of the study in large population. So that in large population, everything cannot be on. The investigator can not go every time to the field and try to collect the data. By sending trained enumerators with pre-designed and pre-test questionnaires, this is more practical method. By postal questionnaires method, so you have nowadays Google Forms. So directly the data is collected from a link. So that is, it is considered cheapest method, but it is less reliable due to the inadequate responses from the respondent. If you do not fill your Google form properly, we may have a chances of missing so many data. People will not try to fill the data completely or will not even try to attempt to fill the forms, then it is a failure. Secondary data is collected by one agency or one person for one study, are utilized by another person or another agency for another study is called secondary data or indirect data collection. It is advisable provided its accuracy is ascertained. For example, we will have a note. Our college student will have 100 intakes per year. So we think every we give the data to Rajiv Gandhi University. So all the colleges of BMS will be giving the data for the admissions. But in one point of time, some government or somebody wants to know the data, how many students every year is admitted for BMS. On the website of Rajiv Gandhi University, they try to take the collection of data. So that becomes a secondary collection of data. So classification of data, it is the process of arranging collected data into groups according to characteristics of interest. It might be race, it might be sex, it might be region of origin, it might be birthplace, it might be occupation, anything. Classification alone will not be enough to draw conclusion. Then it will be made into presentable form by arranging in tables, the process of which is called as tabulation. So we have so many classification of data and interpretation of data like pie charts, bar diagrams, diagrammatic representation, tabular representation. All these things come under that. Presentation of data. A tabular presentation of data, general principles of construction of table. The first one is tabular presentation. So tabular should be numbered. Title must be given to each slide. Headings of column and rows. So be clear or concise. Data must be presented according to the size of importance, chronological, alphabetical, etc. No table should be too large. So you might have some 12 to 13 rows and tables, rows and columns in a table. More than that, they should not exceed. Footnotes may be given. For example, what does a row indicate? What does an column indicate? What does the serial indicate? Or what is the heading of the table? All these things has to be written. Types of tables: simple, cross, manifold, and compound. So simple tables you have already known. This is the basic table where you say which are the places of a district and number of cases of certain disease. For example, here the example is gastroenteritis, number of cases in a particular district, and how many percentage of patients have been distributed. So simple table, only one piece of information in the tabulated. So what is that one piece of information? It is about the gastroenteric cases in taluk wise in the period of June 2020. The age is example age, sex, height, weight, etc. Example for simple table is the table that is given here. Above table is simple consolidation of 90 observation which are grouped under 5 taluks. It easily tells us the distribution of cases taluk wise and also the proportion of occurrence of taluk wise. So it denotes in which taluk how many percentage of people are having G and how many cases have been considered positive. So, and total of the 6 districts, how many, 5 districts, how many in total cases of G is there? This is a very simple table representing the distribution of GE cases. Cross table. So there is always a comparison of cross table. And what happens in cross table? Two characteristics of or two variations, variable presentations simultaneously on row wise and other column wise to establish certain relationships. Such tables called cross table or Dichomatous tables. Example, table number 2, distribution of intestinal parasitism among PM, that is protein energy malnutrition and non-protein energy malnutrition children. So infestation of Ascaris, Jardis, all these things are here, and PM number 40 and PM number 85. So how many percent? The above cross table provides information on occurrence of an event or related to another variable and it's represented as 1 to 1 cross. So there is comparison of 440 PM and PM number 440 and non-PM number 85. There is a cross one-on-one cross table. So manifold or compound table is a third type of tabulations where many things putting together in the table is called manifold or compound. So compound is too much number of data is more. Distribution of children by age, health checkup, and periodically. Health checkup periodical table is here. So, what is the age group? So each age group, how many health checkups the child went, which is once in a month and once in a 3 months and once in 6 weeks. How many is that? So you have multiple data in a single table, that is called manifold. The second type of representation of data is graphical presentations. It is a way of analyzing numerical data. A graph is a short of chart through which statistical data are represented in the form of line or curves dot drawn the coordinated points plotted on its surface. These are used to draw diagrams for quantitative data or continuous data. Examples are line graph, histogram, frequency curve, frequency polygon, scattered or dot diagram, line graph. These things I think you people have learned in your earlier classes of pre-university and even in high schools. So how do you represent the graphical representation? So in that also we give histogram. That is also called as staircase or block diagrams in the area diagrams, in which the area of the rectangular blocks will proportionately to the, there is, you have a two axis of to draw a histogram mark, that is x-axis and y-axis, and along with the rectangular blocks you try to represent the data of class boundaries. So diagrammatic representation, the analysis is qualitative data are bar diagrams and pie diagrams, pictogram or map slot diagram. So first one is the bar gram or the bar diagram. This all comes in the columnar x-axis and y-axis. Over that we try to analyze the collected data into it, and you interpret this in the form of bar diagrams. So pictogram you have seen in news and even in maps, they try to show how many people, male, female, how many people of this state. So the first picture depicts the pictogram or picture diagram, and the map diagram you tend to show in weather forecast and other things you would have seen in that. There also they tend to show, and even the distribution of certain diseases can also be interpreted in map diagrams. Pie gram or a pie diagram, cost of construction of house, how many people have been using luxury house, all these things. This is the construction of pie diagrams. This way you can try to analyze. This is about how do you represent the collected data in the forms of tabulation, pie charts, and bar diagrams, and etc. So, coming to the core part, vital statistics, very important portions for the community medicine people, because we deal with the communities birth, marriage, divorce, death, disease, and health status. So, what is vital? Vital events of human beings are birth, marriage, divorce, and health and death. So, vital statistics or demography is a scientific study of human population. Something related to the human population study is called as vital statistics. A branch of demography is called as vital statistics, and conventionally numerical records of marriage, birth, sickness, death, by which the health and growth of community may be studied. How is the health status? How many people are dying? How many people are dying for malnourishment? How many people are dying uh, for poverty? How many people are dying because of ill health status? All these things comes under vital statistics. Is a branch of biometry, deals that with the data on law of human mortality, morbidity, and demography. Purpose of vital statistics in it is having community health, administrative purpose, health programmed organization, legislative purpose, government purpose. So in community, what we say is they would describe how the level of community health is. To assess that, that is vital statistics in community health is benefit to diagnose community illness and discover solution for illness. For example, how many people are having portable drinking water supply near to house or inside the house. That is how you can assess the health status, the requirement of water to that community, whether everybody is having tap or not, and there's a water supply that enters the house or near to the house in a locality. Everybody has open defecation, or they have a toilet constructed at home. So Sulabh Sauchalay is present. So all these way you can assess the community health status. Then coming to administrative purpose, it provides clues for administrative action to create administrative standards to health activities. So how do you assess the administrative status? So how can we administer whatever the necessity needs are there in the community where they're trying to fail, and because of that they end up in some diseases or some infection, and some health statuses decline too. So wherein you need an administrative effort to implement the needs of the community. Health programmed organization to determine success or failure of specific health program of undertake overall evaluation of public health work. So you might require, see, when during COVID we wanted a program that has to manifest in implementing to curative treatment, preventive, promotive aspects of the disease. So wherein you need a particular program, we have Swachh Bharat Abhiyan, when we thought because of pollution and pollutants in the environment, we might end up in so many diseases. And when we talk about Sulabh Shauchalay, we thought open defecation is the major drawback of the community to spread the diseases, especially the uh, high unhygiene techniques of practicing open defecation can lead to several diseases. So to prevent that, there was some health program organized. So that way, this purpose is served. Legislative purpose to promote health legislation to state, local, state, and national state. Health for all is a legislative statement from the health sector of India. So that is one is very full. So everybody has a right to have health. So PHC, primary health centers, sub centers are being uplifted along with other programs. Government purpose to develop policies, procedure at state and cultural level. Uses to evaluate the impact of various national health programs, to plan for better further measures of disease control, to explain the hereditary nature of the disease, to plan and evaluate economical social development. It is a primary tool in research activity to compare health status of individual one nation and with the others. So you can try to use this vital data to evaluate certain health statistics or health program, whether this particular program is running well or not. For example, DOTS was introduced in RNTCP when things changed from National Tuberculosis Control Program to revised National Tuberculosis Control Program. They try to see the impact of national health program, whether this is evaluating whether the previous method was working, this is working. That is why vital health statistics plays a major role. Aims and objectives of vital statistics: population estimation and forecasting. So there's one outburst, so what is the population in this particular area. Based on that, you try, there is, if at all there is 10,000 people staying in that locality, we try to implement minimum 10,000 people should accompany the medicines that is supplied from the government. The staff that is available in the hospital should be able to treat that 10,000. Otherwise, they will implement in increasing the staff, medicine, and medical requirement. That is how estimation and forecasting is done. Analysis of health trends. What is the health trend? What is people in need for this particular health trend? So how to analysis it is based on the vital statistics. Program planning, monitoring, and evaluation. So how do you plan a program? For example, next week there is pulse polio program. Before 3 months to 4 months, they try to collect the data from the each primary health center. In under them, how many children come under below age of 5, and they try to estimate in 3 months how many newborn can be born. Based on that, they try to plan the program. So how many children may need vaccination, how many vaccines should be brought or purchased or manufactured, and how many should be distributed, how many workers is required to be implemented for pulse polio program, and even evaluation whether the program is conducted properly or not, whether all have been immunized or not. So this is how the program planning is done based on the vital statistics. Operational and administrative decisions. So if you are planned, then how do you operate? And an administrative decision, how many administration techniques has to be implemented, and that has to be analyzed. How many can be administered, how many doctors may require, how many field visits can be done, how to prevent non missing of children. All these comes under those. Each program has a different administrative decisions, providing measures for health and disease of community. So, what is the health measure that they take for a certain disease, and what is the treatment? Where is the protocol of treatment? Is there any change in the medicine required? If there is a failure of drugs, all this is analyzed. And disease of a community, this particular disease, for example, when you're going to South Africa, we know that there is a lot of malaria. So how do you prevent that disease enter into your body? Those things in this community, which disease actually is overlaying, and what is a necessity medicine to be sent to that particular community, what is a requirement, what is a lab facility requirement, what are the tests that has to be analyzed to diagnose a particular disease. All that are the aims and objectives of vital statistics. Sources of vital statistics: civil registration system, national sample survey, sample registration system, health survey. So all these things are the places where you get the vital statistics data. So continuous, permanent, and compulsory recording of national sample survey. You have a sample survey office only where they analyze the survey data, and the national family health surveys and district level household surveys can also be done. Apart from that, census is also done once in 10 years. So what are the instruments that is used for measuring these vital statistics? Instruments for measurements are rates, ratios, and proportions. Rates are how many at specific date into 100 by how many at the same time. Proportion is number of deaths due to AIDS divided by number of deaths due to all cases into 100. So how do you proportionately compare? So for example, there are 10,000 deaths in a day in some particular area. For it, it is in Bangalore. So this is a crude death rate. You don't know for what purpose the person is dying. So there's 10,000 deaths in one day for in Bangalore. So you try to take out the data that is a core data. So when you have a crude data, you have to analyze, and to analyze proportionately for AIDS, they say there are some 100. So 100 deaths were due to AIDS. So 100 divided by 10,000 into 100 is a proportion of that particular disease. So measures of morbidity. Morbidity is defined as any derivation, subjective or objective, from the state of physical or mental well-being due to disease or accident. So they might end up in deaths. Those are considered as morbid conditions. Units of measurements: person who are ill, the illness or periods of spells of illness that these persons are experiencing. Uses of morbidity data to prevent the morbidity, that is first use. Apart from all these use, it is for the prevention of morbidity and to prevent the complications of that particular morbid disease condition. So monitoring and evaluation of disease control program, they give a picture of extent of nature of disease burden in the community and help to decide the priorities. So there are 10,000 cancer patients in the district, and they end up in death, maybe the fourth stage. You analyze what is the state of metastasis and at what stage this person of these people are of cancer, and which people of cancer or which category of stage of cancer can end up in death. So you try to evaluate and help them to decide, and then help the health sector to decide the priority. So fourth stage or first in a treatment they try to give, then the third, and to prevent to enter the third and fourth stage, first and second stage people will be treated. So they segregate, they classify them. They give a comprehensive, accurate, and clinically needed to formation of on patient characterized data, request for basic research, basic for etiological studies, and play vital role in prevention. So they go for analysis of Nidan or etiological studies and why this thing might cause this particular disease and how can we prevent the cause. So that plays a role in prevention. So uses of morbidity data. So incident rate, very important for exam point of view and even to understand. I just want to tell you Apart from the definition, what is incident? Any new case that is registered today is called incident. This incident, same today, my case positive for COVID. Tomorrow, I will not be a positive case of COVID. Tomorrow, I will have a COVID infection in my body till I become negative for 10 days, 14 days, whatsoever the period of infectivity. But I am not an incident case tomorrow. Tomorrow, I will be a prevalent case of COVID. But at the end of 14th day after I become negative, my samples are tried to become negative. That day I will not be as an incident or also as a prevalent case of that particular disease. So any disease which is newly detected is called as incident. So define a definition of incident rate goes like this: is the ratio of the number of new cases according in a definition population during a specified period of time to the population at risk in the same period experienced as rates per 1000. So incident is equal to, you can numerically state this as number of new cases of a specific disease during a given period of time divided by population at risk during that period into 1000. Specific incident rate is attack rate, secondary attack rate, cumulative attack rate. So, what is prevalence? Prevalence is ongoing disease, old plus new. So, today I have positive for particular disease. I am an incident case, but tomorrow also I am positive for the same because I am running that same infection for some period of infectivity period. I am a old case, old plus new case, but till I become negative for that particular organism, I am called as prevalent case. But if I'm newly detected, I'm called as incidence rate. So today, the world largest prevalent disease in India is diabetes. So we are the largest prevalent country for diabetes because we are having ongoing cases. We have old plus new, and that is not a curable disease. Once it has come, you can prevent reversible, that is different, but most of the time it is a disease that runs throughout your life. Once you're diagnosed as HIV positive, you can never be a negative HIV positive patient. So then that is a prevalent case. So you will be a prevalent case of. So in that case, India is now the leading this diabetes country throughout the world, a prevalent disease in the world. So we are running more towards diabetes. So we have a scope to prevent that. So we need to do that. Coming back to the prevalence, the word prevalence refers to all current as well as old and new cases at a given point of time or over a period of time in a given population. The total number of all individuals to have disease at a particular time divided by the population at risk of having diseases at this point or midway through the period. Uses of prevalence. Prevalence helps to estimate the magnitude of health or disease problem in the community and identify potential high risk population. Prevalence rates are especially useful for administrating and planning purpose. Example, hospital beds, manpower made available, rehabilitation facilities, etc. Crude death rate, first one comes under mortality rate. There are so many, crude birth rate, all that. So mortality rates, under which we have first one as crude death rate. It is an effective measurement to see the mortality condition of the community. It is calculated as number of deaths occurred among the population. So today, how many people died in Bangalore, among the population of Bangalore at given geographical area, that is the Bangalore, in a year divided by mid-year population into 100. That is how many people died in Bangalore, in, that is the geographical area. Population among the Bangalore population, that is, you might have some 100 people who have died in Bangalore in year divided by mid-year population, that is a specific period. Today if is the specific period. So crude death rate is used to compare the health status of different communities or places. CDR can be decimal or CDR once in 10 years, annual once in year, and quinquennial, that is once in 5 years. Specific death rates, whatever the reason people have died, that is true death. You might not be telling cardiac arrest, cause, or diabetic mellitus, or a cancer, or even a natural death. Any reason a person is dead, that is the calculated for the particular period and particular population is called as crude death rate. But when it comes to specific death rate, you ask for what is the reason. So the specific factor influencing the death are taken into account separately. The rates are calculated specific death rates, example IMR, MMR, etc. That is infant mortality rate is IMR, maternal mortality rate is MMR. So, infant, for example, what is the infant mortality rate in the month of February? February 2024 in Bangalore, how many infants are dead? That is specific. How many mother are or maternal mothers who have actually had a delivery? Maternal mothers or maternal deaths, MMR, maternal mortality in particular time, a specific death rate. Age specific death rate, how many children are dead in this particular age group and in this particular geographical area, that is age specific. IMR, infant mortality rate, it is an important age specific death rate because they are more prone to get diseases and death. IMR is considered as comprehensive index because the status of IMR depending upon the health status of mother as well as child is important. So they can assess whether the antenatal, prenatal care is taken care, postnatal care is taken care. Otherwise, IMR can occur. So you can understand the health facilities or health status of that particular community is good or not. IMR defines the ratio of total infants deaths to total live births per 1000. Number of children dying below the age group of 1 year divided by number of live births into 1000. Perinatal mortality rate. This deaths occurs from 28th week of gestation to 7th day after the delivery. So perinatal, this is again a specific death rate based on a woman who is pregnant and is of 28th week and above gestational week to 7th day after delivery. So how many people are dead in that period? So you understand PMR about the status. Based on that, what is a complication and how can you prevent in further cases in the community? Neonatal mortality rate, deaths occur from the 7th day to 28 days after the delivery. Within 1 month, what is the why did this child die? How many infants died? That is neonates between the age group of 28 days after the birth. Before then from the 7th day of the birth to 28th day, how many deaths have occurred? Then post neonatal mortality, that is after 28 days till the child is of 1 year, that is post mortality death, post neonatal mortality. Child surveillance index, that is 1000 under 5 mortality rate. So people who the children who are under the age group of 5 years, how many people have died by, that is 1000 minus how many people under 5 mortality rate divided by 10 is to be calculated as 100 under 5 mortality rate divided by 10. Under 5 mortality rate is number of deaths occurring under the age of 5 divided by number of live births into 1000. Coming to case fatality rate, number of deaths due to particular diseases divided by number of cases recorded of the same disease into 100. It is also known as killing power of the disease. So what disease have the power to kill? That is the case fatality rate, number of deaths due to this particular disease divided by number of cases recorded of the same disease. For example, there are 10,000 people who have been recorded with breast cancer. And for this year, out of that 10,000, how many people have died of breast cancer? So it might be around 1,000. 1,000 divided by 10,000 into 100 is the case fatality rate. Expectation of life. How do you calculate the life expectancy? This is an indicator used to give an idea about average duration of life at a given age in an area. This is calculated from the life table technique. Expectation of life calculated at birth gives the idea that average number of years a newborn is expected to survive. It can be calculated from different age group separation or separately. For example, we know Japan people live the highest, they have old geriatric age group around they reach more than 100. Earlier in India also we used to live more than 100. We still have people who live more than 100, but our life expectancy because of modernization and because of our food and our lifestyle has reduced to be around 60 to 70. I hope at least it stays to that rather than declining. Let it incline or at least it stays stagnant. That is expectation of life. Fertility indicators of or fertility rates, that is crude birth rate. So how many children are birth at this particular day and particular year or particular region, that is called as 3 points you have to understand: number of live births in that particular population in particular time period. This is what crude birth rate. It might be anything: male, female birth, in based on age, sex, anything. You don't have to divide. Crude is nothing but it is a complete raw factor, raw data that you get. Number of live births which occurred in the population at a given period, geographical area during a given year divided by mid-year population of the geographical area during the same year into 100. 1000. It is an important vital index to know the population increase and to compare the population growth of various countries. We are the leading population country in India. So that is the crude data. It is called crude because the factor influencing the birth like age, sex, occupation, racial differences, etc., are not specifically taken into account for its computation or calculation. SBR, specific birth rate. So we will ask separately whether it is a cesarean birth, how many people, how many with normal uh, vaginal delivery. So if specific influencing in the birth taken separately into account, such rates as called as specific birth rate. General fertility rate is number of live births per thousand women in the reproductive age group, that is 15 to 45 is the reproductive age group. In that, how many people delivered this year? General fertility rate in a given year into 100. So general marital fertility rate is like, 15 to 45 is the reproductive age group. In this age group, number of live births per thousand married women in the reproductive age group is given as general marital fertility rate. So number of children, that is birth per thousand married women in the productive age group in a given year. Total fertility rate is the average number of children that would be born to the woman if she is experiencing the current fertility pattern throughout the her reproductive age group. For example, 15 to 45 is the reproductive age group. How many children in that her reproductive age group, how many children she can bear? That is the total fertility rate. Average number of children that would be born to a woman if she experienced the current fertility rate throughout her reproductive age group. So gross reproductive age rate is average number of daughters that would be born to a woman if she experiences the current fertility pattern throughout her reproductive age. In the calculation of this rates, only female births are considered as they are going to be the potential mothers for tomorrow. So calculation of the rate of is equal to that of total fertility rate, but only female births are taken into consideration instead of all the births. So crude birth na tagonala, they will only take about the female births. So net reproductive rate, average number of daughters that would be born to a woman if she experienced the correct current fertility rate and mortality pattern throughout her reproductive age. This is calculated by using life table technique. NRR is nothing but net reproductive rate is one, means the population is stable. This is the most effective measurement for measuring population growth. So they we say हमारा एक हम दो हमारे एक, if they follow then it will be NRR is 1. Age specific fertility rate, number of live births in year 2000 women in any specific age group is age specific fertility rate. So how many people women, how many live births will a thousand women in any specific age group, it is from 15 to 45 age group, specific age group, how many age specific fertility rate she can produce. Crude marriage rate, so it is defined as total number of marriages during a calendar year divided by mid-year population. So 2023, how many marriages occurred throughout the year by divided by mid-year population of that particular 2023 year into 1000 as crude marriage rate. Cross marriage rate, total number of marriages during the year divided by total number of unmarried person aged around 15 to 45 years into 1000. So you analyze how many people married or marriages are married during that particular year divided by how many people were eligible to marry, that is 14 15 years people here, which people come into category, divided by 1000 is the gross marriage rate. Health survey, so we spoke about vital statistics wherein we spoke about incidence, prevalence and its measurements, measures of mortality, morbidity. And coming to health survey, very important, sometime it is asked for 3 marks. What is health survey? A survey in a research method used for collecting data for, from a predefined group of respondents to gain information and insight into various topics of interest. So they can have multiple purpose. So they might be collecting this data for so many things. How many children are born? See, death, birth rate. A corporation collects it for so many reasons. You can go for Aadhaar card updation. You can go for admissions for school. You can go for registration of an house site. You can go for adoptions also. All these things for multiple purpose the health survey is used, and researchers can conduct it in many ways depending on the methodology that the research person chooses or researcher chooses. The objective of survey or health survey programs are to be to develop a means of providing valid, reliable, and comparable information at low cost to supplement the information provided by routine health information system, to build the evidence based necessary for policy makers to monitor if health systems are achieving the desirable goals, and to assess if additional investments in the health is achieved the desired outcomes. For example, there was their vision 2020 to make sure all people have right vision, they have the right to have vision. So cataract surgeries were done out of free of cost, camps on, but still by 2020 this mission failed and they extended the mission. So what failure they made, so all that is additional investment they try to do to uplift the health status. So to provide policymakers with the evidence, they need to adjust their policies, strategies and programs as necessary. Target population, who is the target people who requires this measures or who requires this assistance from the health sector? The target population includes any adult, male or female, age 18 or over, living in a private household, population in a group quarters, on military reservation or in other non-householding living arrangements will not be eligible for the study. So for survey study or health surveys, whose target population, whom on which the surveys can be done? It is above 18 years, adult male or female people, or who are living in a private household, and the population who are in group of quarters or military reservations. All these people can be used, or non-group people cannot be used, like non-household living arrangements, all those people. Health surveys generally include measures of risk factors, health behaviors, and non-health determinants or correlates of health such as socioeconomic status. The range of measures that can be included is wide, and a variety of survey. Age, gender, and race, ethnicity are the basic demographical variables that they include in the survey. Socioeconomic determinants of health include education. So basic education for is required if you have to add them for a survey, because they should know basic knowledge. So literature is very important. So they should be not illiterate. So income, geographical region, urban or rural of resident. Social factors can act as casual agents or they can be affected by health. For example, low income can result in poorer health status, but poorer health status can also affect earning capacity, capability, and even the income. Tobacco use, alcohol use, diet, physical exercises are common health behavior that are included in the health surveys. I think I am in the end of my session. I would like to add few things apart from the subject core. So in the coming exam for third BMS Swasthavritta paper 2 part B, you might also have this chapter as an important topic. 5 marks, they might ask few questions like measures of mortality, what is the measures of morbidity, what is incidence, quote example, what is prevalence, quote example, what are the measures of vital, what is the source of vital statistics, or what is the source of health statistics, what is health statistic, define health statistics, define vital statistics. Especially 3 marks, they might have asked you what is incidence, what is prevalence, what is health survey. 5 marks, they might ask for health survey, or write a brief note, define vital statistics and write a brief note on crude birth rate or crude death rate, and you have to try to write the definition of crude birth rate and the formula, and you can explain why it is called crude. So all these things comes under this. Even they might ask you what is health statistics, sources of health statistics, aims and objectives for 5 marks. Any other doubt you can mention in comments, I would like to reply.
Thank you so much, ma'am. Any doubts regarding this session will be forwarded to you, ma'am, and your
Okay.
answer will as well be forwarded to them. Thank
Okay.
you so much, ma'am. It
Thank you.
was a very informative session where you have mentioned all the details about the topic. Thank you so much for accepting our invitation. In a short due, you accepted in an invitation and you took this session. Thank you so much, ma'am. Any queries will be forwarding to you, ma'am. This session will be uploaded in our YouTube channel where maximum students can take advantage of the session. Thank you so much, ma'am. Thank you for
Thank you,
accepting.
organizers,
Uh,
and
uh,
thank
okay,
you
ma'am.
for giving me this opportunity. Uh, Panchajanya session has been a great platform for so many students, and I think you people are doing a great job. And thank you for selecting me and giving me this opportunity to present you a small topic. Thank you. I hope this is useful for the students.
Thank you so much, ma'am.
Thank you.